On schools, you should have a list of 7 principles that have been agreed today in relation to schools, and the advice that was adopted from the medical expert panel on protections and practices that can be employed in schools to support those environments. This is a state and territory issue. I want to make this really clear. Commonwealth does not run public schools, state schools. They are run by state governments. They set the policy. They set the rules. All states and territories are operating within the principles that we've set out here in these 7 statements. And rather than go through them with you, because I know you'll want to get to questions, they're there before you. They'll be posted. And secondly, there is a lot of very helpful, I think, instructions and advice from the medical expert panel for schools that deal principally with the safety of teachers and other staff. The health advice has always been consistent that this virus behaves very different with children than it does with adults. And for children, the health advice has been very clear that schools are a safe place for students to be. I think where the confusion arises is that for teachers, they are more likely teachers are more at risk in the staff room than they are in the classroom when it comes to how the health advice plays out and the impact of this virus on children as opposed to teachers. That means that we need to have proper arrangements in place for teachers and other staff in schools, obviously to protect their work environment, but at the same time, that doesn't lead to the same rules applying for students because they have a different level of risk. And so that is the advice of the medical expert panel, and that is contained in the principles and in the advice that is tabled today. The National Cabinet also agreed to the COVID-19 operational plan for people with disability, and that builds on the $1 billion in financial assistance for NDIS providers to support increased costs and to maintain business viability, particularly over this period.